Thank you for joining Congressman Mark DeSaulniers' town hall on the impact of coronavirus on communities of color. We are fortunate to have an esteemed panel of guests with us today, and we'll be introducing them shortly. Today's event is Congressman DeSaulniers' 130th town hall since coming into Congress. We will take questions from Zoom and Facebook Live, as well as questions our office received prior to the event. To ask a question through Zoom, please submit it through the Q&A box at the bottom of your screen. I will now turn the town hall over to Congressman DeSaulniers.
Thanks, Chanel. I want to welcome everybody and thank our panelists. You will find that they're terrific. So we want to get to them and questions as soon as possible, but I do want to thank you all for joining us for this important topic. And it's important for a number of reasons. First and foremost, because of the pandemic, but it also illustrates some of our struggles that I think fortunately this country is having a honest and open conversation about when it comes to equity and making sure that everybody gets access to healthcare in an equitable fashion, but into everything. This country is about equality and opportunity. And I think when we're all open to that, based on merit and hard work, it works better for everyone. So I am, sometimes these are painful discussions to some people, but at this point in my life, I am very encouraged that we're having these conversations and we're acting on them. So the pandemic has been a learning moment for all of us, to all the people who've lost their lives and their families, a horrible tragedy, but we can be prepared and learn from their suffering and their loss so that these things don't happen again, or if they do, they're less impactful to fewer people. So that's what the town hall is about today. I do want to thank all of my staff, and in particular Chanel, who's our terrific district director. We have been recognized largely for her work twice by the Congressional Management Foundation in DC for work that we do with the community. And it really is a tribute to Chanel. Out of 535 offices in the Congress and the House of Representatives and in the Senate, we have been recognized twice for our constituent work and our transparency and innovation. So I'm proud of my staff. I'm particularly proud of my district director, our district director. So with that, we're going to run through a brief PowerPoint. I am going to go through quickly, so if it's too quick, please realize that you can go back and get this information on our social media and on our website. So with that, let's go ahead. All right, so this is obviously the title, and time's flying by. Next. Whoop, we're going too fast, Chanel. I said I was going to go fast, but not that fast. So as always, we start with our district. This is the shape of this is our district. It's all in Contra Costa County. All jurisdictions that I have represented, either in the local government, the city, the county, the state legislature, now obviously in the federal government. It's a great district, but it's very diverse. We have some real, what we referred to when I was a county supervisor as pockets of poverty. They're not, I always thought that was a misnomer because if you're in them, it's not a pocket, it's a community, and those are serious. And then on the other extreme, we have some of the wealthiest communities in the Bay Area and in the country. And then we have a lot of middle class, middle income. So very diverse on many levels, economic and other. Next. So these are data, this is data from our health department, the total population and the number of cases. And as you can see, for people who have not been impacted by this and may think that the deaths and the suffering of the pandemic happened somewhere else, they clearly do not. As I said, we can learn from the experience we've gone through. For anyone who's read a terrific book called The Great Influenza on the Last Pandemic, really an amazing history of how far we've come when it comes to public health since then. But it still was an impactful event. Next. So this is just, if you wonder about our ethnic background, we are diverse, but we still are disproportionately European. So a lot of changes, but we want to make sure that everybody has, as I said, equal opportunity to healthcare. And I think we do, relative to the rest of the country, a really good job here. And you'll see that in some of the statistics. I'm very proud of the county health department, the work they did on protecting public health during the pandemic. They have a long history, and we should all be proud of this in Contra Costa County, of a public health department and a health department that is recognized around the country, and certainly in this state, for its excellence, and for the people who work there, who are quite remarkable. And I will say, as a taxpayer in this county, I feel like I get really good value. People work there because they want to serve the public, and they want to serve a diverse community, and they do it well. Next. So these are some of the underlying things where we've discovered, it probably not a surprise to a researcher, but these are some of the numbers we have so far about inequality and access and protecting people's lives. So these numbers are here for you to peruse. They will get, we will get more as we have researchers delve more into the experience we've all just gone through the last year and continue to go through. So what do we do about it? How do we make sure everybody has access? The health departments, and this has been a hard process. The National Institutes for Health in Bethesda, Maryland, Center for Disease Control 3 years ago did a study knowing that we were going to face another pandemic on how we were prepared, and worked with the World Health Organization. And that report actually came back very favorable, that the United States was positioned well to protect its citizens. Unfortunately, for a variety of reasons, not the least of which, an administration in the last 4 years that, in my view, and it's pretty factual in terms of quotes, did not want government to work well, actually wanted it to work well for a certain component of the population. And as a member of the Oversight Committee, where we do a lot of hearings, it's very clear to me that not believing government should do well was an administrative nightmare in the last 4 years in our COVID response. This administration, I think, has done a remarkable job of letting good, bright career public servants do their job in the public health field, and we've all benefited from that. I think everyone wants government to work efficiently and effectively. And we've got an example of that here. It's not perfect. It's a human institution. And human institutions, the nature of all of us, is we're not perfect, and neither are the institutions we're in, but there are some that do a really good job. A lot, actually. So here are just some of the things we're trying to deal with to make sure people have factual, evidence-based information. We'll go through these quickly. Again, if they're hard to keep up with, feel free to go back and check them out. I'm going to put my glasses on because this font isn't big enough. I can get my Costco readers here in spite of my vanity. So you can get the vaccine. One of my sons got one today, his first one, the Pfizer vaccine. So they're available for you. And we're really ramped up here and across the country. As you can see, you can get walk-in clinics. So I'm really proud of, again, the work that the health department's done and our partners in the health community here in the East Bay. Next. So they're not safe. There is this myth. Unfortunately, I don't know why people believe these things, but social media has contributed to our disinformation on multiple levels. And when it comes to health, it's particularly disturbing in my view. Politics also equally disturbing because it divides us. But we go through a vigorous process in this country from lessons learned to make sure that medicine is as safe as it can be. And vaccines are no exception to that. So the FDA goes through a very, very thoughtful process. Has been in time some criticism from people that there's too much due diligence, but these are safe, and you have to remember that the disease and vaccines are statistical. They're driven by how do we protect as many people as effectively as possible, and they're safe. they're not perfect. People are still going to get COVID, a small percentage of people, just like the flu. But that wouldn't stop people from smartly getting a flu shot. And in this case, obviously getting a COVID shot. Well, I'll let my two experts go into this in more detail. But we've learned a lot when you think of a year ago when we started this trip through this pandemic. But we've learned that you need to get the vaccine. Our immune systems are all different. As somebody who is a survivor of cancer, pneumonia, sepsis, and MRSA, I am very aware of my immune system and try to protect it as best as I can, particularly as I get older. So we're all a little bit different genetically, but you need to get the vaccine, please. And not just for yourself, but for your family, your neighbors. This is how we all get together, just like wearing masks and social distance to protect one another. And to get out of this so businesses can reopen, people get back to work. Brands, I think there's differences within the brands, but they all work, they're all effective, and the sooner you get one, the better. So there may be instances that you have concerns, talk to your doctor about that, but get a vaccine, please. And that's our last one. As always, feel free to contact us. There you have our contact, our three offices, and I'll turn it back to Chanel.
Thank you, Congressman.
You're welcome, District Director.
All right, here. Next, we'd like to introduce Dr. Sherlyn Cook. Sherlyn is in internal medicine at Kaiser and Martinez. Dr. Cook earned her undergraduate degree in biology from Cal Poly, a master's of public health and behavioral science and health education from UCLA, and earned her medical degree from Stanford. After completing the residency in primary health and internal medicine at Alameda County Medical Center, she now serves Contra Costa residents in the Martinez medical offices. Dr. Cook, will turn things over to you. Dr. Cook, you're on mute right now.
Oh, I'm sorry, I'm muted. Yeah, thank you very much. I'm really happy to be here. I'm going to go through some slides and focus primarily on the vaccine itself. And I've been introduced, so we can go ahead and just move forward from that. But I'm going to focus on the 5 things that I think you need to know. And these are the most common questions I get from my patients. Why is the vaccine important? How does the vaccine work? How were they developed so fast? Are they safe, and are there any side effects? So the first question is, why is it important? And I want everyone to just take a really good look at that sphere. If we can back up just for a second. I need you to look at this. This is an electron micrograph of a coronavirus. And I just want you to notice that there's the ball and there's these red things sticking out of the ball. These are called spike proteins. And as I go through the talk, I want you to remember that term spike protein, because understanding the spike protein is really important in understanding, 1, how the coronavirus infects people, and number 2, how the vaccines work. So it's very critical. So moving forward, why is it important? In 2019, there really was no coronavirus to speak of. Basically in 2020, it became the 3rd leading cause of death in the United States, which is staggering if you think about it. Then we can move forward. So the other thing that particularly is what we're speaking on tonight is that COVID-19 disproportionately affects communities of color. You know, we know there are higher rates in California and higher death rates for Latinx individuals, higher death rates for African Americans, and also the case rates for Pacific Islanders are quite high. And income also comes into play. So it does not affect everyone proportionately. However, I do tell my patients, this virus cannot be trusted. So even if you think you're a low risk individual, we don't always predict who it gets, but across the board, it affects disproportionately people of color, elderly people, essential workers, and particularly those in cramped conditions. But these things do not mean that anybody can't get it, because anyone can get it. Move forward. So looking at from an equity lens, we do know in California data, if you take a look at the Latinx, they make up about 39% of the population, but 49% of the cases. And disproportionately, they've only got 19.5% of the vaccinations. So that's quite low. And also African Americans, about equal number of cases and equal number of population, about 6% in California, but only 3% of vaccinations. So, you know, people are not being vaccinated equally in proportion to the population. So that's one thing that's important, and it also affects death rates. So we can move forward. So how do they work? And I think this is a critical question that people want to know. So we can move forward. The first thing, there are 3 vaccines right now, Pfizer, Moderna, which we'll talk about, and everyone's heard of Johnson & Johnson, which has been paused, but is coming back out. So we're going to move forward and focus mostly on the, how they work. But the bottom line is all of them work to teach your immune system how to recognize and fight the virus that causes COVID-19. And this is how any vaccine works. They teach our immune system how to protect us by fighting off a pathogen or something that can infect us. Can move forward. So remember that ball with the red spikes on it? Here, the spikes are orange. But how did this thing come about? How did they work? Well, the thing that you need to know is that spike protein is essentially like a key that goes into a lock on our human cell. We have something called a human cell receptor, and it's an area on our cells where that spike protein binds with our cell, and we are able to become infected with the coronavirus. So when the scientists discovered this back in January 2020 on this particular virus, they were quickly able to figure out the genetic code, and they were able to essentially make synthetic messenger RNA. So the messenger RNA is something that all of us have in our bodies. We all make it all the time. If we strain a muscle and our body has to repair that muscle, messenger RNA comes in with the code of how to put those proteins back in place to heal that muscle. Same thing with skin, same thing with anything else. So messenger RNA is not foreign to us, but this messenger RNA is specifically to make the spike protein only on the coronavirus. And once the spike protein is in our system can produce antibodies specifically against that spike protein. Just keep in mind, the infectious part of the coronavirus is in the sphere, it's in the ball. Those spikes only serve to allow it to connect with our cells, and then they're able to inject their infectious part into us. So we can move forward. So how is this different than other vaccines? Well, there's 3 major types of vaccines we'll go through quickly. Most people have had the flu shot. It's been around for years. And to make the flu shot, it's called a protein-based virus, where they have to culture the flu virus, and it takes months. And then what they do is they they do a kill on it, but it's not partially dead. I mean, it's dead. It's not infectious, but it's what they call an attenuated pathogen. So if you were making this type of coronavirus, you would have to culture it, and then we just pull out that spike protein, purify it, put in a virus, and then ultimately on the right-hand side, you make an antibody. We already went through messenger RNA. All we have is the code to make the spike protein that's injected in that vaccine. Our body actually produces those spike proteins, and again, we make antibodies. The Johnson & Johnson is what we call a viral vector vaccine, and there's genetic material, again, pulled from the coronavirus that allows it, but they put it into an adenovirus, which is a cold virus. So they kind of take the cold infectious part out of it, and they just use it as a vehicle. So I look at it like it's the UPS truck. You put something in the UPS truck, it comes, it delivers its product, and it's gone. So it's delivering that spike protein, which again allows us to make antibodies. So the end result, all of them end up with spike proteins. All of them end up with us making antibodies against the spike protein. And we can move forward. So again, the thing that's kind of novel or new about this is that the Moderna and the Pfizer are the first vaccines where they've actually used messenger RNA technology that's been approved in the United States, and it makes just the spike protein. And again, the spike protein is just a way to get it into our system. It's not, there's nothing infectious in that vaccine itself. Flu viruses and just about all of the vaccine against viruses are going to be what we call the protein based. And there's very few viral vector viruses. So Johnson & Johnson is kind of new, and AstraZeneca is also a viral vector virus. So we'll move on to the next slide. So how did they get developed so fast? Let's move forward. There's a few factors with this. While the messenger RNA vaccine is new, it was developed based on pre-existing knowledge. And if we look back about 30 years, there was a researcher, Dr. Kariko, who was from Hungary, and she came over and was working in the University of Pennsylvania. And she was one of the lead scientists who's been researching messenger RNA for years, not initially for vaccines, but for cancer therapies and for other things. How do we get a message into the human body to go fix something? But she had a rough road of it, a hard time, because it was sort of one of those technologies that was developed, but never really got put to use. But the knowledge was there. And then moving forward, we have another researcher who hasn't been around quite as long, but Dr. Kizzmekia Corbett, who works for the National Institutes of Health, she's a coronavirus expert. And a lot of you might remember SARS virus, which was around a few years ago, and also the MERS virus, which is around in like 2012. So these are also coronaviruses. So coronaviruses are not foreign to us. So she was very familiar with them, and also with the spike protein. So if you marry the knowledge of, we've got a spike protein expert and we have a messenger RNA expert, you marry the two, you can come up with a good thing. And that's exactly what happened. Dr. Corbett was one of the primary researchers on the Moderna vaccine, and Dr. Kariko was one of the primary experts on the Pfizer vaccine. So both of them, but they shared knowledge. That's the other thing about it. It's a global pandemic. People were not trying to keep all their information in, they shared. So this just simply represents a coronavirus with the orange spike protein connecting with the purple human cell binding domain, and that's where it would infect us. But if our body puts out antibodies and it kills off this spike protein, that can't happen. So we'll move forward. The other question is, how did it happen so fast? There are very rigorous processes for approval of a drug in the United States. There are 3 phases. I'm not going to get into the details, but all I can say is that they sped these phases up exponentially because there's a global pandemic, which was a very high stakes thing, which killed a lot of people. But there, as Congressman DeSaulnier already mentioned, there were a lot of people in these clinical trials that happened very quickly and also simultaneously throughout the world, and also in the country, but many places in the world they did. So you kind of had the same process, but it was expedited. And the other factor moving forward is that there was a lot of funding. The United States government funded Moderna over $4 billion to quickly develop this vaccine. And while Pfizer didn't take direct money to develop the vaccine, they also had, basically agreements to purchase the vaccine once they were developed. So a lot of money was put into this. And we'll move forward again. And so safety. The Moderna vaccine and Johnson & Johnson are approved for 18 years and over. Pfizer's down to 16. Just as everyone should know, there are never any studies done on pregnant, breastfeeding women, and initially children are not involved. Currently, they do have ongoing trials with Pfizer with children, and I believe Moderna has started, or they would be quickly. Very few contraindications where you absolutely could not take the vaccine, which would be a severe illness, or if you had a major allergic reaction to the first one, we probably would not give you the second one. But other than that, it's usually things that we can manage medically very easily. So the vaccines are safe, as the congressman already mentioned, and we'll move forward. It's really important to know, in spite of what people see on the internet, you cannot get COVID from the messenger RNA vaccines. And the reason is very simple. There's no infectious product in there. The only thing it is a message to how to make the spike protein, which is an attachment device. So if it can't attach to us, if the virus can't attach to us, it can't inject this infectious material into us. So the messenger RNA, the Pfizer and Moderna, only make the spike protein. There's no live virus in there. We can move forward. And the other question that comes up is, are there side effects? And I'm going to tell you yes. Most people will get side effects, pain, swelling at the injection site. Some people get headaches, fatigue, muscle aches. Most people are well in 2 days. And very rarely there's anaphylactic reactions, which can be easily treated. And in rare cases, people do have symptoms that last a little bit longer. But, you know, by far, it is much, much, much safer to get a vaccine than to get COVID-19. So we'll move forward. And just in summary here, there have been, you know, over 569,000 deaths from COVID-19. We've given over 232 million vaccinations, very rare anaphylactic reactions. And there haven't, you know, there's some cases under investigation, but there have not been any proven deaths from the vaccine itself. So I think the odds are heavily weighed towards the safety of the vaccine. So I got the shot. We still ask you to follow the same type of safety protocols. Today, they announced that the mask mandate was lifted if you've been fully vaccinated. If you're outside, but indoors, you basically do not want to share your air unless you're with your family, you know, or small groups of vaccinated people. But other than that, and of course, wash your hands. So thank you very much for your time. And I encourage everyone to get your vaccine if you have not gotten it. Thank you. And I'm done, Chanel.
Thank you, Dr. Cook. And I got the shot. I got my second vaccine last Thursday, and I had mild symptoms, as you mentioned, for 24 hours, and I was good to go once the weekend hit. So I look forward to just learning more and hearing what, you know, other people's thoughts are when it comes to the vaccinations. But from our team here, everything has been pretty mild as well. Moving on to Mr. Gilbert Salinas. Gilbert is our Chief Health Equity Officer here in Contra Costa County. Prior to coming to Contra Costa County, Mr. Salinas served as Chief Clinical Officer at Rancho Los Amigos National Rehab Center. Mr. Salinas is a national leader in violence prevention and youth and patient advocacy. He served on the planning and peer review for the U.S. Surgeon General groundbreaking report on youth violence. Mr. Salinas, the floor is yours. Let me get your presentation up here as well.
Thank you so much, Chanel. And thank you, Dr. Cook, for your presentation. Very informative and very timely. Today, we'll be talking about COVID-19 in Contra Costa County. The broad picture, you can go to the next slide. There you go, thank you. The broad picture with data, ensuring equity through vaccine distribution, vaccine sites, mobile vaccinations, community partnerships, and the ease of access. Next slide, please. So currently we are in the orange tier, and this means moderate COVID-19 spreading within the community. Based on these numbers, you can see that the statewide positivity rate is 1.5%. In Contra Costa, we're at 1.8%. And if you look at this slide, you can also see that our health equity quartile positivity rate is currently 2.8. That's down from 16% in January of this year. If the trends continue as they have been recently, we will continue to be in orange tier for the next several weeks through June 15th. Next slide, please. So this is just a snapshot of our data and our current numbers as of April 27, 2021. As of today, our vaccine doses that we have administered has surpassed 1 million doses. The number of people that are partially vaccinated is 68.4% of the county population that's 16 and older. 47.2% of the county population that is 16 and older have been fully vaccinated here in Contra Costa County. Next slide, please. 40% of our Costa County residents who identify as African American are at least partially vaccinated against COVID-19. 51% of Contra Costa residents who identify as Hispanic or Latinx are at least partially vaccinated against COVID-19. Next slide, please. In recent weeks, residents who live in neighborhoods highly impacted by COVID-19 have begun to account for a similar share of Contra Costa's new COVID-19 vaccinations as residents in less impacted areas. Based on this graph, the darker blue color is that is based on the numbers of communities that have been hardest hit by COVID-19, the less under the Healthy Places Index, and the dark green color is the trend line for the folks in the healthiest communities. And the data now shows that vaccination rates have evened out by the week of April 11th, with each quartile accounting for about 25% of the previous week's vaccinations. So we are getting closer to closing the gap. Next slide, please. So we are committed to attaining equity. That is our high priority. We have worked really hard on making sure that there's a fair and equitable distribution of vaccines, particularly in communities disproportionately impacted by COVID-19. And some of the ways that we are doing this is through outreach efforts. Our community engagement and outreach team has provided presentations on education, safety, and vaccine distribution information. We also provide vaccination site locations throughout the county. They're spread in all communities, with priority areas also in communities, historically marginalized communities. We've also made it easier to schedule appointments. We've eliminated some barriers for scheduling of appointments. We have also established mobile vaccine clinics. We feel that mobile vaccine clinics can get deeper into communities, and it has set us up for great partnerships that have been established throughout the county. And lastly, our Adult Ambassadors program. We have hired 17 adult ambassadors that come from the community, 3 program coordinators that represent Central, East, and West region, and 1 program director, program manager that are boots on the ground, facilitating outreach and canvassing communities, educating our community members, and bringing them to the table to get vaccinated. Next slide, please. We're building relationships with community-based organizations like United Latino Voices, Choices in Aging, NAACP, One Accord, and Hijas del Campo, in order to reach and educate people in historically marginalized communities about the importance of vaccination. They have really been this is just a list of some of our partners, but it's really through our community partnerships that we've been able to establish successful outcomes. We have organized work groups to collaborate on outreach strategies with each community, focusing on Latinx, African American, Asian Pacific Islanders, youth and young adult ambassadors, older adults, and adult ambassadors. We've also ramped up our advertising efforts. We're developing an integrated campaign currently with Univision with culturally relevant and actionable content so that we can educate Contra Costa's Latinx community about the importance of regular COVID-19 testing and vaccination, communicate with multi-general homes about preventive measurements, and create consciousness and promote safety measurement. We're trying to demystify some of the myths that are out there related to COVID-19. Next slide, please. So this is just a snapshot of some of the ways that we are removing barriers to make it easier for everyone, especially for those that have found the process to get vaccinated confusing, frustrating, and inconvenient. We think this move is important for our community. And most importantly, we think it's central to our efforts to get vaccine to our hardest hit communities in an equitable way. So making sure that we are making it easier to schedule appointments, getting rid of certain steps and processes in order to get an appointment. We're opening up more walk-in clinics so people can go get their shot whenever they have time, not whenever we have time, but whenever they have time. Next slide, please. We've also facilitated mobile clinics in some of our hardest hit communities. We based strategically, we based these locations on our Healthy Places Index, lowest 25th quartile scores. And it's in those communities that we're taking vaccine out to our community, to folks at their doorstep. We have established great partnerships with our faith-based communities, community-based organizations, and our business community. Clinics have increased from 400 vaccinations per week when we first got started to over 16 vaccinations per week. Recently, we partnered with the state to bring state-ran mobile vaccine clinics to Contra Costa County with California Office of Emergency Safety. They have been running state-ran mobile vaccine clinics in our communities. Just over the past 2 weeks, we have facilitated over 7,000 vaccinations through these efforts. We also have plans to continuously increase these efforts in our historically marginalized communities. We want to ramp up these efforts. We think they're important. We think that we are reaching many folks that would not necessarily have access to vaccine. It might be due to a social determinant of health, thinking about transportation, or maybe it's the individual that has 2 jobs and is raising 4 children. They just might not have time to come out and get their vaccination. So we're trying to make it easier by providing some of these mobile vaccine clinics in communities. We have opened several walk-up vaccination sites, so there's no need to make an appointment. Through our state-ran mobile vaccine clinics, they run Monday through Sunday, and there's no need for an appointment. You just show up and get your vaccine. And also, by visiting our website or our appointment line, we have now made it easier for people that are homebound, who are unable to visit our sites. They can request a home vaccination through our mobile teams. So that's another way to reach our homebound folks. So which vaccine will I get? Current CCHS is currently administering Pfizer, Moderna, Johnson & Johnson, and it's also known as the Janssen vaccines throughout the county. We believe that all vaccines are proven to be highly effective in preventing hospitalization or death from COVID-19. And people who are fully vaccinated are also much less likely to be contagious or transmit the virus to someone else. This is a schedule of our current walk-up clinics that are happening now and that are coming up. And we've also listed the type of vaccine for each state so that folks are aware. And we're giving folks an option. I'll just give you one example. We are at the Pittsburgh Youth Development Center, and we will be facilitating 5 days of Pfizer, 2 days of Johnson & Johnson. We're giving folks options so that if they want one vaccine over the other, they can come and receive it on the days that they are available. Next slide, please. I just wanted to talk a bit about our adult ambassadors. They have been a huge lift to our efforts around vaccination in our communities. They are designed to support underserved, isolated, and marginalized communities. They're also there to increase community trust in and credibility of COVID-19 programs, provide COVID-19 awareness and prevention education, and increase access to and usage of testing and vaccination opportunities. And I just want to say and point out, that our ambassadors are from your community. They are folks that were hired from your community, and they have been very crucial to our efforts, a huge asset in terms of getting folks registered, providing services at all of our mobile vaccine events. They do everything from logistics, translation services, registration, crowd control, traffic control, whatever it is that they're needed to do. They go out into the community and canvas. They're doing face-to-face outreach, which is great when you see them in action out in the community. I've seen them in action. I'm so impressed by all of their work. So I just want to thank them for all of their hard efforts. But that's a program that we believe strongly in terms of reaching our hardest hit communities. And lastly, for our last slide, I just want to thank you. And this is a picture of our adult ambassadors in action, and also a picture of one of our vaccine events at Sojourner Truth Presbyterian. This is Pastor Kamal Hassan receiving his shot of Johnson & Johnson vaccine. This occurred a couple of months ago, and I just wanted to highlight our adult ambassadors in this picture. And lastly, I just want to thank everyone for attending this evening, for your time, for coming out and taking advantage of this town hall. I'd like to thank all of our Contra Costa Health Services staff. They work tirelessly. They show up every single day. And there's not a single day that goes by that they are not trying to improve or that they don't have equity as a priority. This is an amazing team. So I just want to highlight our team at CCHS, and a special shout out to Director Anna Roth for her leadership during these trying times. Thank you very much.
Thank you, Mr. Salinas. We'll now move on to our Q&A section of the town hall. If you have a question, please ask the question by pressing the Q&A button below, or you can ask the question through Facebook Live as well. Our first question is from David from Richmond. What legislation or programs and funding will be directed to our community of color to address these inequities?
Maybe if I just start, one of the real successes in Congress, particularly the last one, the rescue plan from the Biden administration that we worked through as quickly as we could. Unfortunately, it wasn't less partisan, but it got lots of resources out to the states. It was a big issue for us in the Democratic caucus, and it was particularly important issue for the Speaker. Speaker Pelosi worked tirelessly to get more support for these funds. So I'm forgetting the total number. I think it was $42 billion to the state of California. There's millions of dollars to the cities and the school districts, but specifically there's a big chunk of money to the state of California and through the state to Contra Costa County into the health program. So I don't know if Gilbert or Doctor has anything in more detail to give, but it's directed to get money out quickly, and particularly on the equity issue, so everybody gets the support they need. And this multiple ways, not just the vaccine, protection, and of course, revenue for people who are unemployed or underemployed.
That's correct. And that is Assembly Bill 1447.
Our next question comes from Catherine from Walnut Creek. Please provide a specific governmental definition of the word equity and examples of how it will be applied. Will it apply to legal citizens as well as undocumented immigrants?
Regardless of immigration status, CCHS is committed to caring and improving the health and lives of all people in Contra Costa County. In terms of equity is defined, it's defined as a state quality or ideal of being just, impartial, and fair. The concept of equity is synonymous with fairness and justice. So we have to keep those at the forefront as we think about equity. We need to also think about justice, equity in social justice, and in healthcare. So it's helpful to think about equity is not simply a desired state of affairs or a flavor of the month or a lofty value or a lofty goal, but to achieve and sustain it, we really need to think about it as a structural and systemic concept. We need to really embed it into our systems and believe in it.
Thank
Well
you,
said.
Mr. Salinas. Our next question is from Pamela from Concord. I have a question about the vaccine and what that means for access through the state. Cal State University and the UC campuses are now requiring the card to go to school. What other entities will require a vaccination card to enter or participate?
That's an excellent question, and I guess it's, it's sort of guesswork, but yes, there has been discussions about what's going to be required to return to school. I don't think that physicians are going to be making those determinations, but I think it has to be looked at from a public health perspective. For instance, flights, people now have to take a COVID test to fly. Some of them, we suspect might require, if you've been fully vaccinated, you may not have to take the test at some point in the future. But I think that when we think about it, there's the issue of you're making me do something, but what we're really looking at is we need to protect everybody. We want to make sure everyone is safe, can get where they're going, can attend school, can go shopping and do whatever they want to do in a safe manner, and make sure other individuals are not jeopardizing their health and safety.
On the school side, Chanel, if anyone's watching who didn't watch our town hall with Tony Thurman, the superintendent of public instruction for the state of California, A. Contra Costin, and with Lynn Mackey, the superintendent of education for the county, we had a robust discussion about this. And the governance issue on schools is very diffused in this country, always has been. So we give a lot of that decision-making up to the individual school boards and their superintendent. So in that regard, they work with the public health folks to make sure that they have the best information, but particularly for schools, as we want to get kids back in school, but we want them and their teachers and the community safe.
Thank you, Congressman. Our next question here is from Joseph from Richmond. What are the chances that one will survive the virus? I am concerned for the homeless population who don't have any place to go. That may also contract the disease very easily.
Well, my premise is that this virus cannot be trusted. There are young, healthy individuals who have contracted the virus and have become very, very ill. There have been older people who have, contracted the virus and they survive. So if you take all comers, your chances of surviving the virus are very good, but we can't tell you who those individuals are going to be, particularly that aren't going to survive. Other than older people are less likely to survive. We've noticed that people in communities of color are less likely to survive. And, if you're a young, healthy 20-something-year-old, you may feel fine and just have a cold, but you may go visit, your mom, who then visits her mom, and then the grandmother becomes infected and is much more likely to become really ill. Death rates really go up significantly once you hit over 65, and the older you get, the higher they get. But there's young kids that have died from COVID as well. So, you can't trust it, but in general, across the board, chances are good, but the older you are, the sicker you are, the more pre-existing conditions you have, the higher your risk.
And in terms of from Contra Costa Health Services, core and healthcare services, healthcare for the homeless teams have continued their daily work throughout the pandemic, providing basic safety, hygiene supplies, symptom screening, and education to persons that are temporarily displaced. And through our California Project Room Key initiative, CCHS acquired several hundred hotel rooms for people awaiting test results for those who were considered high risk due to age or health. Since vaccines became available, our mobile teams have been going to homeless encampments to vaccinate as many people as possible. So we are continuously providing services to this population.
Thank you. Thank you both. Our next question is live from Zoom. Will an annual booster shots be required?
That's an excellent question. And the short answer is we don't know, but I suspect that there probably will be a booster required at some point. But if you think about when the trials were done, they were started, early in 2020. So we're about a year out from those trials, and they're continuing to monitor those individuals in the early trials and seeing what their antibody levels are. So as soon as they start to decline and fall off and put them at higher risk, then they could determine when would a booster be needed. But right now, we don't know. We are still trying to figure that out.
All right, we're gonna take our next question here from Facebook. Ellis asks, can vaccinated grandparents safely get together with non-vaccinated grandkids under the age of 16?
That's a good question. If the kids have been at home and they're healthy and they don't have any particular symptoms, we feel in general that the risk is low, that as long as the grandparents are fully vaccinated. And some folks are instituting temperature checks in their homes before you come in. But I think once kids are out and about more, it would probably be more risky. But I think as long as the adults are vaccinated, those who can be vaccinated, and the kids are healthy and have not really been out and exposed a lot, I think generally it would be okay. But, again, that's one of those things that eventually we hope children will get the vaccine too, but it has not been approved for children yet.
We are getting multiple questions that ask, can a person with cancer get vaccinated?
Short answer, a person with cancer should get vaccinated. Unless you're severely, severely ill, you would need to speak with your oncologist. But if you're walking around, going throughout your daily routine, there are certain chemotherapies that are going to suppress your immune system. So generally, your oncologist would try to get you vaccinated prior to the chemo starting or in between when your immune system is up, so you can develop that, the immunity. But yes, absolutely.
I just chime in here. As a survivor of chronic lymphocytic leukemia, if I can ever say it, I went through this, and my oncologist made sure that they were talking with the infectious disease persons and people. And yeah, you should get it. I get it.
Thank you, Congressman. The next question is from Deborah from Zoom. What are the steps we are taking to prevent the next pandemic? How are we partnering with talents and communities to roll out a Green New Deal to ensure everyone's health and livelihood in a holistic way?
Well, we've in the Congress, we've talked about this a lot, funding the National Institutes for Health, funding CDC at a more robust level, and then getting that out to support communities, as we're talking about right now, state and county health departments, local folks. So we're doing all those things. I think on the transportation side, in the transportation bill that we're now discussing, was in a meeting with Secretary Buttigieg today to discuss some of these issues because I'm on the Transportation Committee, as many of you know. We've talked to researchers, great group at Berkeley, who do research in this field, and the amount of money we need to spend on our rolling stock, on our trains and buses, school buses in particular, and then on our heating and air conditioning systems in all of our buildings. So there's a lot of research going on in this. We're going to spend a lot of money making sure that public buildings and private buildings have the best circulation they can, amongst other things. So we're going to continue to support the public health system, and we're going to build it into our infrastructure so that we can prevent these kind of things from happening in the future.
We have 3 minutes remaining, so I am going to try to get to at least 2 more questions here. Our next question that we have is from Facebook. Marcia's question is, among the 3 kinds of vaccines that are available, which one is the best? And her second part of that question is how long each vaccination lasts, the duration of the vaccination protection.
Well, I'll start with the duration, and like the question earlier, are we going to need a booster? We don't really know how long they're going to last because they've only been out about a year. So it's going to take more time. And between the 3, my view is whichever vaccine you can get today is the best vaccine. You don't want to delay and risk getting COVID. All of them are extremely effective. The Johnson & Johnson, if you look on the face value, is slightly less effective, but it's just as effective against severe disease, hospitalization, and dying. So, in general, that's what we care most about, to keep you out of the hospital, out of the ICU, and keep you alive. And all of them are very, very effective with that.
Thank you. All right. Let's see. Our last one here is Pamela from Lafayette. I'm concerned that our governor is not continuing to prioritize, as of April 15th, communities of color and poorer communities hardest hit by COVID-19. What can be done either by you or the federal officials to ensure that these communities do not continue to be left out of the vaccination program?
When I think about our current efforts in Contra Costa County, I think about how much COVID-19 has really exposed a lot of the disparities in our communities of color. And for CCHS, equity is a priority. It's a goal for us to make sure that we are reaching these hardest hit communities. We want to continue to double down on that. We do not want to pull away from that. This is not the time to run a victory lap against COVID. COVID still exists. It is still killing the folks across the country. And so we must continue to partner with organizations and continue to prioritize equity and not give in on thoughts around pulling away from our efforts on equity. So we really need to continue that.
And I would ask the questionnaire, if you can send us, if you have specific examples of how the state has not been equitable. And certainly when we started, I think collectively we were not as equitable as we would want. But I'm not aware that the governor has ceased to put an effort into equity. My observations have been that he has made it a priority. So if you have specific instances, please feel free to correct me if I'm wrong, but that's not my observation.
Well, that was our last question, Congressman. I'll turn it over to you to wrap up before we close out the event here.
Well, I just want to thank our panelists. You were both terrific. We did a lot in an hour. We got a lot of questions and a lot of information. Gilbert, thank you for what you do. I'm very proud of the county as a former county supervisor. I think you're doing a great job. Doctor, thank you so much. You lived up to your previous presentation that I managed to see when you did a presentation of the Eastern Contra Costa County NAACP, and I told Chanel, we both saw it, and I said, "Ooh, we've got to get that. That is a great presentation." So thank you both so very much for taking the time out to do this. To everyone who watched, thank you. If we didn't get to your question, as always, feel free to contact us. We're going to do everything we can. Chanel does a great job, and our staff in DC as well, to answer all your questions, even the ones we weren't able to get to. So thank you so much. We've got more town halls coming. I've got one coming up with the IRS because it's that time of the year, and we're going to have a representative to answer your questions for that as well. Chanel, when is that?
Yes, that's tomorrow at 4 o'clock.
They work me so hard. It's hard for me to keep up with all these meetings, but I'll be there. And thanks again. Have a wonderful evening and be safe.
Thank you, Congressman. And just to the audience out there, the town hall will be available on our Facebook page after the event. If you would like to rewatch or share with a friend, please do not hesitate to contact our office if you need any help. And thank you again for joining us. Good night.
Thank you.
Thank you.
Thank you.